All right, sir. So, do you recommend PGS to all patients undergoing IVF?
No, we don't. We certainly don't recommend PGS for all patients. Some patients would certainly not need PGS, although the trend is moving towards genetic screening of all the embryos of all patients having IVF. But at the moment, we need more randomized trials being done to clearly understand whether PGS is a necessity for all patients going through IVF. At the moment, PGS is mainly indicated in patients with repeated implantation failure or patients with repeated miscarriages.
All right. What optimal endometrial thickness should be there for implantation?
Typically, what we expect the endometrium to be is around 10 millimeters. However, there's a lot of work being done to optimize the endometrium. You do get a lot of women who are poor responders as far as the endometrium is concerned. And there's a lot of adjuvant therapies now available to enhance the strength of the endometrium, including the thickness.
Okay. What is your opinion on use of GCSF in patients of implantation failure?
So the use of GCSF infusion is very new and is under quite a close R&D phase. The couple of clinical trials that have happened, which are randomized, are very small scale, and we need to watch out for more data, more evidence on a larger scale multi-center randomized trials to understand the efficacy of GCSF and its role in human implantation failure.
Yeah. So what dose of GCSF do you recommend?
So I, being an embryologist, would not have a absolute kind of idea about what is the dose that the infusion is kind of recommended for. But I believe that the GCSF is given a day before the embryo transfer and a day after the embryo transfer as well.
Yeah, correct. Sir, what is your take home from this conference, from Genesis?
So I thoroughly enjoyed this meeting, although I would have loved to stay here for a bit longer. I only stayed for one night, but it's remarkable to understand that there are conferences now that actually are very specific to certain parts of assisted conception. What I really loved about this conference is it was very multifaceted. There were aspects of various aspects of ART that were discussed, including implantation, which obviously I talked about. Professor Zavos spoke on the sperm side of things. Professor Gleister spoke very well yesterday on other aspects of IVF. So it's nice to have closed forums which are very stimulating rather than a really, really large forums with thousands of people. Because what people want nowadays is a one-to-one interactive approach. People want the ability to ask their questions freely and have the answers to them. So such small forums are the perfect place, and with well-learned people around, doctors get their questions, bench-related questions answered much more quickly.
All right, so thank you so much for sparing us.
Most welcome. Thank you.